In 1966, a 10-year-old boy from Hamlin County, South Dakota, was sleeping out with his buddies when a skunk crawled into his sleeping bag and bit the boy in many places, including the face. Despite providing the child with the old-style vaccinations, the boy succumbed to rabies within a month. There's been only one more human case of rabies in South Dakota since, and that was also a young boy attacked by a skunk. Even with present-day technology, once rabies gets into the nerves, it is at least 96% fatal in humans. Rabies is believed to kill more than 55,000 people every year in Africa and Asia alone, most of them after a bite from a rabid dog. By comparison, in the U.S., rabies kills only about 2 or 3 people per year. Over the last 50 years in the U.S., we're down to that low number of annual deaths due to an effective vaccination program for domestic dogs and cats, along with improved rabies post-exposure prevention, or rabies PEP treatment. Domestic animal vaccination has been successful in containing rabies, but not in wild animals. The newest PEP is so protective because it includes 1 injection of antibodies targeted specifically against rabies, along with a series of 4 vaccinations. Human cases of rabies in the United States are rare, but we still have plenty of animal rabies. In South Dakota, over the last 10 years, we've tested 6,500 animals suspected of having rabies and found 5% tested positive. Specifically, 195 skunks, 48 bats, 47 cows, 22 cats, 16 dogs, 8 horses, 3 goats, and 2 raccoons were rabid. Please take note that none of the 16 dogs infected had been vaccinated, giving credibility to the value of vaccination. Of all the bats tested, only 3% were positive, while 48% of the skunks tested were rabid. This gives another reason, besides bad odor, to avoid skunks. Just last week, a Sioux Falls man was walking his dog late in the evening near many evergreens when something was crawling on his forearm, causing him to brush off whatever it was. When he got home to the light, he noted tiny double bite marks on the forearm, which were highly suspicious for bat bites. Since South Dakota bats are usually bug eaters and not arm chewers, this incident was worrisome. The doctor recommended rabies PEP for him. Bottom line, vaccinate your pets. Avoid messing with wild animals, and seek immediate medical care whenever bitten by any animal.